device I'm holding here is called the mNzK device. It's a cool way to remove fat. It was developed by physicians at the Mass General, which is Harvard's affiliated hospital. So it's got a lot of credibility behind it. What they have done is they have created a painless, non-invasive, no downtime way to remove 20 to 25% of the treated area's fat. The way this device works is that it cools down the fat preferentially to a point where it will be terminally affected and then eventually it dies. That dying process occurs over the next 1 to 2 months, and the body eliminates that dead fat cell naturally. It does not affect the surrounding tissues like the skin or muscle or organs, because it's at a higher temperature than what would affect that. They discovered this by 2 case studies. One was when a woman was riding naked on her horse in very cold weather, and she noticed that she lost some fat on her inner thighs a few months later. There's another medical phenomenon called popsicle paniculitis, which is found in kids that stuck on a popsicle too long, it freezes the inside of their cheek. And there's fat in there, and it ends up dying over the next couple of months. And so they use that now to their advantage with this device. How it works, it takes about an hour to do a cycle, and it's usually about 2 cycles per area. One on the left side, one on the right, so a total of about 2 hours. During that time, the patient is sitting there watching TV, DVDs, playing on their computer, or relaxing. It's absolutely painless. When you are done, you can go out and go to the gym. There is no downtime whatsoever. So what I'm going to do is demonstrate the application of the process and show you someone getting the procedure done. Hannah is applying a gel pad to the skin that protects the skin from the cooling of the mNzK. And we're smoothing it out here. At this point, Hannah is applying the mNzK handpiece to the area we're going to treat. She aligns it, and then once she's sure it's aligned properly, she'll apply the vacuum. And the vacuum takes the area that we're treating and puts it into the handpiece. And now we'll gently, we're going to put Janice into the chair. Now this is the way Janice will be for the next hour with this handpiece applied. And Janice, how do you feel?
Fine.
Fine? Any discomfort?
No discomfort.
Very easy to do. And she can watch a movie and so forth. It will get gradually colder, and it will become actually, she won't even feel it over the next 5 minutes. She feels a little sucking sensation, tugging sensation right now. This process will take 1 hour, and then we'll go to the other side of the belly and do that for an hour, and then she's free to go to the gym. This is the first edition of the mNzK. It's one of 25 machines in the country currently. The areas that we can treat with this machine are currently the belly, the love handles, and the back. There's other handpieces in development to do the thighs and buttocks area. But this is a very early on in this process. And we're lucky to have one of the early devices. The ideal patient is someone that is within around 10 to 15% of their ideal body weight. Their skin should be relatively tight. Very loose skin with the associated fat won't be as good a result as someone that has tighter skin. This has been a very popular treatment for men, especially the ones at the gym who are working out and just can't get rid of those little love handles. This is perfect for that. On my website, I have several examples of men who were treated one, in fact, had one side done and not the other, and shows a contrast between the two sides. The results will be evident at 6 to 8 weeks and fully be effective in 3 months. The fat that is removed is permanently removed. You do not replace your fat cells. So the results should be long-standing, unless you ruin your diet and you gain weight and so forth. So, because the fat cells that are left can enlarge and take up the space where the fat cells were killed. So you have to keep your weight stable and don't binge on your eating.